Welcome and thank you for joining us for today's webinar, Social Cultural Impact of COVID-19 in the LatinX Community. My name is Marianne McChesney and I am a member of the Boston University Alumni Relations staff. Today's webinar is presented by the Boston University School of Social Work, and the BU Alumni Association is proud to offer it to our 339,000 alumni around the globe. Before we begin, I'd like to welcome the many members of the BU community who are joining us today from far-reaching places, including Washington, California, and Texas, Arizona, Missouri, Ohio, and Pennsylvania, from Florida and Maryland to Maine, Connecticut, New York, New Hampshire, Rhode Island, and Massachusetts, and Puerto Rico. It's wonderful to see how many alumni have expressed interest in this topic, and we are glad to welcome you all here today. For a few housekeeping notes, today's presentation is being recorded and will soon be available for on-demand viewing in the Alumni Association website, and we will send you a link after the program has ended. Also, our panelists are looking forward to answering your questions at the end of the program. However, you are welcome to submit them at any time using the Q&A box. You can find this box by hovering over your screen, locating the Zoom toolbar, and selecting Q&A. Now it is my great pleasure to introduce our featured speakers. Dr. Luz López is a clinical professor at Boston University School of Social Work and serves as the Global Health Core Director at BU's Center for Innovation in Social Work and Health. The center is dedicated to expanding the impact of social work in healthcare and public health in order to improve the health and well-being of vulnerable populations nationally and globally. As the center's Global Health Core Director, Luz develops partnerships with international organizations to advance social work leadership and culturally responsive practices in health globally. Her research and practice interests are in the areas of trauma due to violence, diverse populations, Latinx culture, HIV/AIDS prevention, and group work. Wilfred Labiosa is a 1993 Boston University graduate of the College of Arts and Sciences. Wilfred is the co-founder and executive director of Waves Ahead, a Puerto Rican nonprofit organization dedicated to working with marginalized and vulnerable sectors of Puerto Rican society. He has been recognized as an activist, community facilitator, and advocate for the needs of Latinx, LGBT, and marginalized groups by government, private, and public institutions and organizations. In addition, Wilfred serves as a member of the BU LatinX Advisory Council. Thank you, Luz and Wilfred, for being here today. It is my great pleasure now to turn the presentation and discussion over to Luz.
Thank you, everybody, for being here. I am so excited to be doing this presentation with my colleague and friend, Wilfred Labiosa, and we're going to talk about the socio-cultural impact of COVID-19 in the Latinx community. And we're going to have a dynamic and interactive discussion at the end. And now we would like to start with a poll, a small brief poll, and we'd love for you to answer quickly.
For the poll questions, the first one, did you graduate from Boston University? Yes or no? Do you identify as Latinx, Latino, Latina, or Hispanic? Yes or no? Question 3, are you both Latinx and a BU graduate? Yes or no? And are you a current student? Yes or no? We'll wait a few minutes for the poll to be completed. All right, I think folks have answered. We'll end the polling and we'll share the results. I seem to be having difficulty with the other questions, Luz.
Oh, close.
So let's see if I
Try
can
again, try again.
stop sharing. And poll number 2, there we go. All right. Poll number 2. What is your related field of work? Social work, psychology, public health, or something else that's not listed? Still getting a few more clicks. Okay, I'm going to end the polling now. And here are your results. Are you ready for the next one?
Yes.
Great. Poll number 3. What is your place of current residence? United States, Puerto Rico, U.S. Virgin Island or other Caribbean island, Central America, South America, Canada, Europe, Africa, Asia, or other? We'll give folks a few more seconds to respond. Okay. And our results. There you go.
Okay.
Excellent. If you would like to share those results at any time, I could also bring those back up again.
So we completed the survey, and Elena who is a graduate student and fellow of the Center for Innovation in Social Well and Health, and she's here with us. And she's going to help move us the screen. So we're going to talk about the sociocultural impacts of COVID-19 in the LatinX community. And I want to say that we're using the LatinX term in this context for today's presentation to include non-binary and gender neutral language. But we know that in Latin America, people also prefer Latina, Latino, Latine with E, with the same purpose of being inclusive. So when we are using Latinx, we're going to be talking about Latinas and Latinos, Hispanic, all together. We are going to talk about the health disparities and sociocultural differences in the Latinx community, identify how the Latinx community has been affected by the socioeconomic disruptions caused by COVID-19, and articulate public policy and treatment strategies to improve services in the Latino community. According to the US Census Bureau, Hispanics and Latinos comprise 18.3% of the total population. Yet, as June 10, the CDC reported that they account for 27.3% of the total number of COVID-19 deaths. There is a disproportionate coronavirus case rates for Latinx in USA. I'm going to give you some examples. In California, there are Latinx individuals represent 70% of all coronavirus-related deaths among the ages of 18 and 49, but they make 43% of the total population in California. Utah is 13.9% Latinx, but they make 37.9% of COVID-19 cases. Oregon is 13% Latinx, and they make up 31% of COVID-19 cases. And in Massachusetts, here where we are, 9.6% of the population is Latinx, but in the cities of Lawrence and Lowell, which has a large number of Latinx individuals, they make up 21.6% of COVID cases. So we see these are statistics that have been reported, but we have to take it with a grain of salt because they are uneven reported statistics for COVID-19. In many states, a full picture of the racial impact that affect this pandemic is not being collected, and is collected differently across states and counties. In many places, racial data for a large percent of patients was unavailable, and this also potentially skews the results. There are shelter-in-place measures that have been in place, and again, it varies according to state or country location. But in all these measures has affected the collective culture in the Latino experience and the emotions that people feel regarding those shelter-in-place measures. Latinx and other immigrants, we are used to human interaction, collective interactions, regular family interactions, and being in isolation, being alone in the house, or being unable to visit each other has an impact, deeper impact than in the larger population. Home is supposed to be a place that we cultivate human connections, and now it can be also a source of stress. And that is because many people may have their children at home, and they are maybe affected by having to manage the demands of homeschooling and taking care of the children while also having to work outside the home, or they are stressed because of loss of jobs or other stressors. So all this may escalate the emotional situation in the homes. In contrast, COVID-19 may also promote creative ways of communications and new ways. And we see families that have been communicating across states or in Puerto Rico through Zoom and WhatsApp and other methods. Staying at home may not be safe for everybody. And we have seen an increase in the rate of intimate partner violence, child abuse, emotional stress, anger, and family conflict in many of the families. And this is affected by the isolation and the lack of contact with school systems and with community agencies and other people, even neighbors, that may be able to see, may be unable to report when something is happening in the home. Domestic violence organizations at the national and state levels are seeing contrasting trends. In some states, we see that the hotlines calls have increased, and the numbers are larger. People are contacting the hotlines. And in other states have decreased because people are unable to reach out for help or unable to call. So we also have to see what is happening according to the region and what resources are available. Adults and children affected by domestic violence and the pandemic are in a situation of being alone and being unable to reach out. And this can be very hard, especially for children. And we have to be alert and be communicating when we see something different among neighbors, or communicate ways in which families can report if something is happening. For Latinx and other ethnically diverse groups, COVID-19 challenges may be compounded also by problems associated with immigration and acculturation. Each specific country and cultural backgrounds shapes how we respond to loss, grief, and changes. One of the situations that is happening is among immigrants and undocumented immigrants is that the person that abused is using COVID-19 to further increase intimidation and fear. Some are giving misinformation about the virus to create fear and increase control. Some give misinformation about the restrictions of health insurance cards and other important documents. There is also threats that if they go out to reach out for help, they may call the immigration office, or if they go to the hospital because they're feeling symptoms, they're afraid that ISIS may come and take their children away or deport them in that situation when their health is compromised. And there is limited access to communication with support systems. So we have to consider these aspects about immigrants. And one aspect that people may not know is that when someone goes to the hospital, it's not mandatory to report if you are documented or undocumented, and the provider should not ask that question. For Latinx families, social norms and familismos suggest that there is the sanctity of the home, family is first, and many mothers put their family before their own well-being. And this can also make it difficult to speak about pain and loss and worries about family members. It can also prevent women from living abusive situations because they're feeling shame and guilt, or because they don't know what's going to happen if they reach out and report to someone during this type of COVID. Where do they go? Many shelters are not open. Where do they go for help? However, there are shelters in Massachusetts that are open, or that have hotels and motels that have been separated to send the families there, or the woman there, if there is a case of domestic violence or interpersonal violence. It's important to ask in your region what services are available. There is also pros and cons of digital technology and COVID-19. One of the pros is that Latinos and other immigrant communities are implementing creative solutions and incorporating the use of technology, telehealth, Zoom, WhatsApp, as I mentioned before, Skype, to communicate with family members, with teachers, and with other providers, with nurses that can be affected by this. But many of the technology, on the other hand, could be a source of stress when talking with someone in telehealth, because we don't know who else is in the room when the person is asking questions. And it's important to assess, who else is in the room with you? Who are with you? Are the children there? Who is listening that may not be in camera view? And if you are going to ask questions, be careful that children are present, coming in and out, and you may ask questions that are more personal through the chat. So the person writes in the chat and is not sharing verbally what's happening. And also give a phone number where maybe they can call, and at the end I'm gonna give you hotline numbers where to call if there is a situation of stress, of domestic violence. You can give the number, and the person maybe can make a phone call in a moment that they can go outside and the abuser may not be present. There is a wonderful tool that was created at the Boston Medical Center, and is the BMC Family Preparedness Plan. It was developed by Avis Fernandez Pastrana, Carmen Rosa Noroña, and the Children Center for Children and Witness program. And it's a tool to prepare parents that may be concerned about what happened to them if they get infected by COVID-19. For example, a single mom, a single immigrant mom, or undocumented mom who gets sick and has to go to the hospital, and she doesn't have a place to have their children. So this preparedness plan have suggestions on how to talk with your child about unexpected family separation due to COVID-19, how to choose a caregiver for your child, and finding a neighbor or a family member or a friend that could take your child temporarily while someone is in the hospital. And in the case the situation gets worse, what to do with the child, who to take care of. It may be that the grandmother, it may be the caregiver of the child, or the grandmother is in the home and it's the grandmother who is in the hospital. But then you may want to separate the children so they don't become at risk. Who's going to take care of those children? And this document, which you do with the person, the family, and a social worker or a provider, provides information and then legal documentation. And they help the family provide affidavits or legal information on how to do this. This is also temporary care. It doesn't mean that the family is giving away the custody of the kids. It's just during the legal, if the person is at risk for COVID-19 or going to the hospital, or if unfortunately the immigration office comes, what to do if they come and they're separated to have resources so the children do not go to the social service system or to immigration. And they also provide information for documented and undocumented persons on the rights that they have here in US and what questions are okay to answer when a medical provider or a nurse is asking questions in the hospital. And again, no questions about being documented or undocumented should be asked in the hospital. During this time, there are also children who have been affected by the pandemic. We are all affected, adults, children, teenagers, being at home and adapted to the changes, adapted to not be seeing your friends, not seeing your support system, not visiting your grandmother or your aunt and uncle if they don't live with you, not being able to travel if the family is in Puerto Rico or in another locations. And sometimes the children may not have words to say and ask questions about what's happening. There is a new tool that has been developed by the National Traumatic Child Stress Network. And it's a book, in a book of series that was dedicated to COVID-19. And this one is Trinca and Sam fighting the big virus. Trinca and Sam and Little Town work together. And it's a book that has pictures about what it means to have COVID-19, the coronavirus, and how it affects the family. And it has been translated to Spanish by my colleague and friend, Carmen Rosa Noroña from the Boston Medical Center and her team. And they adapted it for the Latino culture. And it's a wonderful tool. It's available free on the website that you see on the screen. And it's a tool to sit with your children if they're young and explain what's happening and why they may not be able to go to the park to play, or why they may not be able to hug their grandmother and they have to say hello from far, why they have to use a mask, or they see the adults wearing masks if they're not using it. And it's also a tool for adults, because while you sit with your child or with your niece or nephew or with another person, you can talk about the emotions that they may be happening, because this is a traumatic experience that affects everybody. And we need to talk about the sense of loss, the sense of change, and the cultural factors. Maybe our families are also essential workers who are in hospitals or in nursing homes and afraid that when they come home, what's going to happen and can they infect their family. Some essential workers have moved to another location, leaving the children at the care of an aunt, an uncle, or grandmother, which is also a big adaptation for the children. Others of LatinX are working in grocery stores or in areas of high risk. And it's important to acknowledge the health disparity there, and that not everybody can have the choice of social distance in the same way. So all these aspects affect our Latino community, LatinX community. Here are some of resources for the Family Preparedness Plan. Again, that is free at the BMC website, and some readings and some other resources, and the hotline if there is a domestic violence situation that is affecting the family is 1-800-799-7233. And that's the hotline in Spanish, 1-800-799-7233. There is also the National Alliance on Mental Health Illness, and they have a guide for how to deal with anxiety, with fear, with depression, and other tools here that are available. And I am really grateful to have this discussion, and I hope that we can answer your questions later and provide resources for all of you. Now, I'm going to have my colleague, Wilfred Labiosa, continue. Here is my email if you want to reach out to me later and ask questions as well. Wilfred, we'll continue with you.
Thank you, Luz. Hi, everybody. I think okay. Thank you, Luz, for that introduction. And thank you so much for everybody joining this space that has been provided to talk about a segment of our community that is so important and is so relevant to what we're living nowadays. I will focus my conversation and presentation on the older and LGBT, Latino, Latina community in general. Let me introduce you first to Waves Ahead and Sage Puerto Rico. Waves Ahead in Puerto Rico and our community centers throughout the island and our community partners focus on the LGBT older adult mental health. But we are open to all. And I always like to say that about 8 to 9% of our population that we provide services to are allies, are individuals who are older adults who are part of the heterosexual or other non-binary community. Why we focus on this and why do we exist? There is a high incidence of mental health issues and public health issues impacting our Latino, Latina, older adult population, not just in Puerto Rico, but throughout the world. Specifically in Puerto Rico, there has been a high incidence of suicidality among older and LGBT older adults. Plus, you add the intersections of LGBT, and then you have there an increase on some of our programs and of our problems that we have. Some of our programs, and I won't go into details of each program, but since COVID-19, we saw the need to bring them into virtual platforms, as well as by telephone. And one of the things that we realized quickly is that a lot of our older adults didn't have the technology to be able to join us in platforms like this one that we're using today for this workshop. So we decided to increase the capacity by starting trainings for older adults about technology. And we did that in a series of personalized and individualized trainings with our population. Since COVID, we really haven't stopped, but have needed to increase our presence online and over the phone. And an issue that we have seen that we have needed to provide is providing food as well as the technology in order for our individuals and our population across the island to be able to receive services. So during COVID-19, I would like to remind of the immigration that there is between Puerto Rico, Dominican Republic, and the US of individuals all of the time. And I wanted to start talking about the statistics that we find between Puerto Rico, Cuba, and Dominican Republic, because not just about the data per se, but also because in Puerto Rico, we have seen that the government and public health officials have not wanted to report and confirm cases, nor report on the recovered cases. One of the things that here in Puerto Rico, we have realized for the last year is that we cannot trust the confirmed cases and that we cannot confirm any of this data because one day you might have confirmed cases of 1,000 plus numbers and one day you will have 5,536. So, and until today, although this data is June 18th, but until today, the recovered cases, we cannot tell you the numbers. This reduction of data and the accessibility to testing and screening affects the mental health as well as the anxiety levels of all of our individuals, especially the older adults. The entry and or departure, in the sense I was having a conversation with Luz while preparing for this workshop, and I addressed the issue that in Puerto Rico, the flights to Puerto Rico have never stopped. And although the government started to implement recently testing, mandatory testing at the airport upon arrival and telling you that there should be quarantined by 2 weeks, 14 days, we know that that's not the reality. They took a while to test individuals, and so COVID-19 might have come to the island throughout this pandemic. The economic financial impact has been incredible in the island. Businesses had to shut down within 24 hours, as well as all the other community centers and clinics. We had, with the privilege and really the successful that we had the support of SAGE in the United States, as well as administration of the local San Juan municipality, that were able to start working with us since February in order to go and launch virtually and over the phone as soon as they would dictate the date. But still, the economy really is impacted. All of our businesses have been impacted, and recently they have started to reopen. The mental health, because in Puerto Rico, we have had not only hurricanes of 2017, we have had droughts, we have had a government shutdown, we have had earthquakes, but now COVID-19 has really brought that issue of mental health and anxiety and depression about the economics, as well as the sustainability of your home. Food accessibility has been in very bad percentages, as well as the public health reporting of the issues that we are being impacted in Puerto Rico. In Puerto Rico, the government and as well as the public health have not really been doing their job. And it has been individuals like myself, organizations like ours, and community-based organizations, religious and or community-based organizations in the mountainside that have been doing the work for the government, not only during COVID-19, but also during the hurricane seasons, as well as during the time of the government crisis last summer. So in order to address the issue of COVID-19, we at Waves Ahead and SAGE Puerto Rico started to develop some educational campaigns. And why we did that. And I wanted to bring to screen, these are some of the resources and some of the educational campaigns that were brought to Cuba and Dominican Republic during this time. They're all educational, they're all informational, addressing the issues about gender violence that Luz mentioned in her presentation, as well as domestic violence, and as well as benefits, food. This is all about the campaigns, and this is just a sample of the campaigns that Cuba and Dominican Republic brought out after the COVID-19 crisis emerged. And in Puerto Rico, here in the left screen, you can see our measurement of the racism. So this was before the situations that have occurred in the United States. This was in early March. The first campaign that Puerto Rican government started to put out in the media and in the TV was these two advertisings here, stating, and what it says in Spanish on the right side is a banner that was brought by a colleague organization of ours, talking that this is to take a shot against racism and take an injection of against racism, because it addressed that the Black female is the one who is the contagious individual who brings in the virus. The Black individual is the one who you need to protect and who's doing the bagging, which in the stores, which is true. And then the white individuals and the white community here are the ones who have the power of control of funds and who can enjoy themselves. So after many organizations develop what is called a mesa social, a social table, that we bring the issues to the forefront in the media and toward the government, we send letters, they changed their take. And this is what came out after that campaign was distributed around Puerto Rico. Now, the Puerto Rican government, it is bringing some of these educational campaigns, and then they have outreach to some of the nonprofit organizations who have implemented educational campaign of domestic violence and COVID-19. And this is some of our educational campaign that we have brought and that we can share with you for coronavirus in Spanish. And also we wanted to address predominantly the issue that a lot of older adults didn't know how to control the situation that they're in their homes. So we started to institute music therapy, mindfulness, as well as yoga and meditation on virtual platform and over the phone. We taught them about FaceTime, we taught them about WhatsApp, and we also gave them these, we printed these out, we also mailed them out, and we also text them out to take care of themselves. Simple things to do during the coronavirus in order to take care of themselves. And these are some of the programming that we have developed for our older LGBT adults, as well as the LGBT and women-led households that we provide services to. And we started to distribute this and provided the image so then other organizations can implement their phone numbers and distribute them across the country. Well, where we're at now, after 3 months plus, we are at, we're still facing a lot of challenges. Although and I'll begin with the economy, so reopening slowly in Puerto Rico, it is not time to reopen. We are addressing the issue of food instability, lack of food for our youth. Our community centers cannot open yet, are not allowed to open yet, although stores can open. So there is a lot of discrepancy between what can open and what cannot open. Services are not opening yet and cannot open by the government standards. Mental health issues are incrementing and are increasing. The burnout of treatment, a lot of our individuals are saying, Wilfred, when are you reopening? We really want to see you. We want that connection. And we continue saying, stay on for a little bit longer. We cannot open yet. And so we are seeing a lot of burnout of treatment. And so we are revamping our services. We're adding new sessions. We're renaming sessions. We're adding spirituality sessions because we see such a connection between religion, spirituality, and ourselves. And so we continue promoting physical distancing instead of social distancing. That was very confusing for our older adults here. The curfew, although it has increased to 10 p.m. to 7 a.m., is not mandatory now. I think that is going to change. The financial stability is increasing, the access of technology is increasing, and we are addressing that issue personally with other organizations here by acquiring a lot of technology that is semi-old and that we're updating and that we're providing to our clients and participants. The long-term public health effects, we're not sure yet where we're going to go. And unfortunately, the government of Puerto Rico have been using this time of curfews and of staying at home to institute a civil code that brings us backwards instead of frontward. And so that civil code was instituted, as well as a voting code that is really going to be interesting on how it's going to be implemented. Civil disobedience have been capped in the sense that the government is really trying to avoid civil disobedience. And when I'm talking about the government, the central government. And so our demonstrations, our conversations with people have been via visual platforms, sending letters, and being in the media. The lack of clarity and oversaturation from government is really stressful, as well as, to say the least, produces anxiety to even us in the public health field and in the field of advocacy for our community members. I want to finish, before we begin our conversation and our Q&A, focusing on the psychological and public health consequences, because these situations, we're not talking about it, and we're seeing an increase of services requests, not only by the LGBT older community, but by the LGBT community that we are providing services to, women-led households, older individuals who right now, in the last couple of days, we have seen an intake of over 22% increase on our services. Loneliness and isolation is still very prevalent in our community. Anxiety, depression, PTSD, increasing of self-medication. Some pharmacies cannot meet the demand, and so a lot of neighbors, a lot of family members are sharing medication. And so that's what I mean by increase of self-medication. And death by suicides. We saw it after the hurricanes, just before the hurricane, when the economy hit Puerto Rico, and now we're seeing it again. The mixed messages about masks and gloves and not to wear here and not to wear there. So it is very important to continue a message that is straightforward, that's saying, you should wear masks in public, you should wear and clean your hands. And also clarify about social distancing versus physical distancing and the difference between that. The reopening of the economy, we need to be very much structured about it and really be able to come to the new normal and really how we're going to address these issues, and continuing the message about education. And I have been saying it over and over again because education is so important, and really to come from the same message. Because we saw a need for the, and we saw the increase of death by suicide by our older adults, we have developed, thanks to a grant and to our collaboration with the Department of Aging of New York City and SAGE New York City, with us, SAGE Puerto Rico, and other organizations locally, we launched during COVID-19 times a suicide prevention campaign that is not only in the media, radio, TV, but also posters in the supermarkets, in the pharmacies, as well as billboards. When you're driving to your healthcare, you will see this campaign. This is just a sampling of all the campaign that we're doing here. I look forward to your questions and answer time. And now let me pass on to Luz and the rest of the crew.
Hi, everybody. So now is the time for questions and answers. You can write them in the chat, and we'll try to answer as many of them as possible. And if we don't have time, then we can communicate with you later. But we're going to try to reach as many as possible. And Elena is going to join us, Adina, to read the questions.
Thanks. Great job, guys. We have lots of good questions coming in, actually. The first one that I thought was really interesting is to talk about, it actually just came in, talking about maybe like what the impact of having babies right now during COVID and infancy with respect to this current virus, if you guys have any particular ideas on that in the Latinx community.
I think that's a very important question, and I think mothers, Latina mother, Latinx mother, have expressed concerns because they're alone in the hospital during the checkups, and then giving birth and having very little children, and not having the regular support that they normally will have of family members that come and are like a village taking care of each other. So that has really increased stress in mothers, and concerns for the babies themselves, who has had less contact with grandmothers and get less contact with the cultural connection, because grandmothers may come, or aunts or uncles, who provide essential love and support, but also cultural aspects that they start bringing to the family. And now that has been stopped for the moment. So families again are using Zoom and WhatsApp to communicate and to show each other's faces and share gifts, but it's not the same, and it's a loss for mothers.
Thanks. Okay, there's a couple questions on housing right now, and so I'm going to combine them a little bit. The first one is, have you guys seen a rise in, because of financial and economic impact with homelessness, and is anyone doing anything about that? And specifically also, if you can speak a little bit to multi-generational living that's common in Latino communities. How do you address the safety of older people and maybe restructuring housing, especially with the economic crisis?
So I could start and then Luz could follow. It was interesting because we haven't stopped the earthquakes. The earthquakes haven't stopped in Puerto Rico. So as of yesterday, we had an earthquake that was felt around the island. And right before COVID-19, on March 14th, the central government decided that there was no one homeless due to the earthquakes. And everybody was kicked out of their shelters and brought somewhere. And we started to outreach to our clients and our all the different providers that we work together, and we started to realize that they were in hotels and with family members, and we needed to do an education about how to take care of yourself if there's elders in those shelters or in those area multi-families or multi-generational in that family unit, because they were all leaving to the supermarket. They were all coming back and forth. They all wanted to do all the activities together, and that is inappropriate at this time and is not healthy. And so we needed to address a lot of that issue by educating. And what I suggest to people is to educate them to say that this is temporary. We don't know how long is the temporary, but that it will be temporary, and that there should be one person that goes out to purchase things to come back in. We have also seen an increase of homelessness here in Puerto Rico, right after the hurricane, of course, and now after the earthquakes as well. And so we have been privileged that the Hispanic Federation has given us funds to develop the first shelter of its kind for LGBT individuals in Cabo Rojo, which is in the southwest part of the island, that we are going to be developing and implementing, because there has been a lot of homophobia, a lot of violence seen against our LGBT people and against older individuals in the shelters that exist right now. And there's not that many shelters here in Puerto Rico. The ones controlled, and I'm going to use that word, controlled by the central government, they have closed down. So only the municipalities, it is up to the municipalities to develop shelters and to be able to house the individuals that are homeless in their cities and towns. Here in Puerto Rico, housing is going to be, the demand for housing is increasing every time. And now that we're in the hurricane season, I just want to hope that we will be okay, but it is going to be increasing even further.
And here in the United States, we also have seen an increase in the homeless population, and now with so many loss of jobs, a real concern of people losing their homes. And in Massachusetts and in Boston, there was a large policy movement and legislation to press the banks and the homes to have a moratorium on eviction. So the governor passed a law recently with the support of many people, including students and faculty from Boston University and others who were very active in the decision to for the governor to pass legislation that says that a person cannot be evicted due to loss of jobs due to COVID-19. But that is for a short period of time. So we are concerned what's going to happen in the next quarter, and what is going to happen with the thousands of people that will not be able to pay their home and their rent, and the economic disparities again that are happening because the people losing their jobs are in the racial and ethnic groups, lower. Yes.
Okay, one more question on how maybe people can reach their communities and what community resources are available. And one of the questions was specific to religious communities and how they could possibly play a role in addressing some of the issues you're talking about.
Yeah, that's a very good question, because there are many religious groups and religious organizations, both in the United States, in Puerto Rico, and in other Latin American countries, who have provided now support and additional support for finding family members who can help take care of children. If we were mentioning the multi-generational homes where there are grandmothers and children at home and parents, and if a grandmother gets sick, the families are sending their children to an aunt, and sometimes if the family is not available, then someone from the church may take care of that child temporarily or provide housing temporarily while some of the members are recovering from COVID-19. And the church are also providing food and bringing activities to the children who are alone, or children that need to be taken care of because the parents are working now 2 shifts as essential workers. So there are organizations that are providing great support here. Religious organizations. Mm-hmm.
Okay, so the opposite of religious would be the ICE facilities, and there's a lot of questions that want to know about the impact of COVID in ICE facilities and with respect to immigration. So do we have any data on what's happening in detention centers? And kind of coupling with that is, do we have any idea how the travel bans are affecting immigration and immigrants and their families? And, you know, especially given the current travel bans to the EU, how do you view that playing out?
So I can tell you that, as I mentioned in my presentation, Puerto Rico has never closed its doors to the immigration of Puerto Ricans coming from the mainland to Puerto Rico, with or without COVID, or maybe infected or not by COVID. But Dominican Republic and Cuba closed their borders, and they haven't reopened their borders yet. Although tourism is supposed to begin again in Dominican Republic and Cuba very shortly, we are not sure when. They have said July. Cuba opens in August, but the president of the United States is using COVID-19 in order to continue suppression of Cuba, as well as Dominican Republic and other Latin American countries. So we will see the impact of that. I know the major airline of Latin America now started to close offices because they have been financially impacted by it. That is going to limit the transit between the United States and Latin American countries and the Caribbean nations, Spanish speaking. So that's going to be impacted. In regards to ICE, I know, and about consulates. Consulates in Puerto Rico closed, and they're reopening now. This week are starting to reopen for transactions and for different processes. I know that in the Dominican Republic, they're closed and they will not open until the end of July. So for renewals and so forth, we're not sure yet. But I can tell you is that the ICE situation, data is not coming out distinctively, but we understand that the conditions inside these are horrendous for children and for adults that are in these
shelters. And I know that in the United States, in the mainland here, the courts, the immigration courts are the only one that remain open, and they continue doing deportation and separating mothers and returning children, including during the night. They're returning children to their countries, saying that they are at risk of COVID, but taking this opportunity to further oppress and affect the children and the adults. The immigration court has not closed and continues. Many children and families are being deported right now. And there are lawyers and organizations trying to advocate for that to change, but it is not. And it's one of the concerns that we have here, and serious concern, and that we need more advocacy.
Okay. Maybe on that same note, Wilfred, you had mentioned in a few of your slides talking about government oversaturation. So I'll throw it to both of you, but I think it was in specific to that. Can you talk about what oversaturation of a government looks like and what that means, and maybe some of the downsides of that, or how you?
Well, very quickly because of the time constraint. But I have seen it in the United States, and I see it here in Puerto Rico. The saturation. What I mean by my comment is that they try to control all the media. By the TV and by providing messages. The governor here goes with press conferences for anything and everything in regards to electricity, to water, and tries to really overwhelm us with messages from the central government. And the messages are really positive. So it doesn't talk anymore about COVID. For the last 3 weeks, we don't talk about COVID. We don't have now the reporting about testing, about positive cases. And in the United States, I try to avoid the news from the States, I have to admit, but what I have seen is that, the president and different governors have taken that realm as well, because politics is predominantly, here in Puerto Rico, we have primaries in August. And so they're using the positive that is coming out in order to win votes, and the primary that is in August, and then the election in November. And so it's all about politics and really how the messages. So we, nonprofit organizations and religious groups, are bringing out messages to continue the education. We're spending money to bring out the messages and to share it. And this type of platform, what I say to folks is, take all the information, all these banners, and start distributing among your friends, among your colleagues, about, you know, your neighbors, because we need to continue educating and protecting ourselves.
Good, thank you. A question about resources for caregivers and interventions, essentially, in how to work with Latino populations. Like, how do you recommend talking to caregivers of COVID patients, and also maybe how to kind of, like, if you have some suggestions on people working with this population?
So at the end of this presentation, and I think it's going to be available for everybody, there are some lists of links of resources and manuals that are available to talk with families. And the Boston Medical Center Preparedness Plan that I mentioned earlier has some guides on how to talk to families and children. And if you go to that website, they also have other manuals available for how to talk with about COVID-19 and how to prepare as clinicians to talk about these difficult issues. And so there are resources available there and at the end of the presentation. So I think we now appreciate everybody's questions and comments. We are pressed by time because it's almost 2 o'clock, and we have now the ending of the presentation, the last words.
Yes, thank you, Luz, Wilfred, and Alina. This was a fantastic webinar, and we really appreciate the wealth of information you shared, along with your insights on the topic, and look forward to being able to share the resources that you mentioned today by putting that in an email to everyone who's registered. I want to make sure that we'd like to thank our alumni and friends for joining us today. And as always, a special thanks to our donors for supporting BU and programs like this. We have several other programs in the coming weeks that may be of interest to you, including on July 1st. We have a conversation with Dr. Ibram Kendi, founding director of the BU Center for Anti-Racist Research, and Andrea Taylor, a COM 68 graduate and trustee of Boston University, who is the former president and CEO of the Birmingham Civil Rights Institute. On July 9th, The Future Is Now, advances in telehealth as a result of COVID-19. And there are a few regional networking events that are being planned online. So keep an eye on the BU alumni calendar for upcoming events. You can find all that at bu.edu/alumni/events and check back often as programs are added on a regular basis. And I want to thank you all again, wonderful panelists. Appreciate our attendees today. Thank you for joining us today, and we look forward to seeing you at a future BU event.
Gracias, muchas gracias.
Gracias.